Hey, is this thing on? Is there a podcast going on? What's a podcast? Man, it has been a long time since I've done a podcast. I was checking back, and it's actually been since 2023, the last time that I published a actual kind of episode. I had one random episode in June, but we are back. Thank you for clicking. This is the Preventive Medicine Podcast.
Overcoming saber-toothed tigers and woolly mammoths, we must now face a new enemy, ourselves. With the rates of diseases such as heart disease, stroke, diabetes, depression, and many others ballooning, we must find a better solution to these modern epidemics. Welcome to the Preventive Medicine Podcast. We believe in building a foundation of health by means of prevention so that you can build the life you want and find fulfillment with no barriers. Hear from experts around the country on how to take your health into your hands. Take control and build a foundation of health for the life that you want to live. And now, here's your host, Ragav Sharma. We hope you enjoyed the show, and if you do, please don't hesitate to subscribe and like for all of our future content.
Oh man, it has been a long time since we have been on this podcast, but we are back. Welcome back to the Preventive Medicine Podcast. So, if you are a brand new listener, then welcome. And if you are returning, then welcome back. I am so sorry for taking so much time away. Hopefully, you all have not missed it too much, and we can hope to bring back some great content. So, for those who are unaware, the mission of this podcast and the reason why I started this in the first place is to help people live lives that they want to live through preventing disease. When I first started this, I saw preventive medicine as kind of a big gap, as we have so many diseases and things kind of going on chronic disease wise, the true quote unquote MAHA, which we'll get into. We haven't done too much about it. And instead of focusing on dumb things like seed oils, like we'll talk about in just a little bit, we need to practice actual prevention of things that'll help us reduce our risk for a lot of these diseases that have been increasing morbidity, mortality, all those kinds of things. Like I said, the mission of the show is to help you all, the listeners, and hopefully, if your listeners are practicing some sort of medicine or some sort of healthcare, then spread that message, spread that word to your patients, to your audience, whoever it may be, to help get people healthier so that we can get out there and do what we want. As far as this show goes, if you are new around here, then I've actually been making episodes since 2020. I was just looking back here. The first episode, June 22nd, 2020, and I was actually a medical student back then. Here I am now, a fellow physician going all the way through medical training. And it has been a while. We've published, I think, 70 episodes since then. A lot of those were between 2020 and 2022. And then once I started residency, things kind of got a little bit challenging, and I really decided to focus in on the medicine and get really good at what I do. So I took a break from the podcast. Here and there, I was like, maybe I can come back. Maybe I have time for it. Release some random episodes. And they never ended up sticking. I always got like one or two out before I was like, I'm getting busy. Let's kind of put that by the wayside because this is completely a hobby to me. I don't make any money from this. Never had a sponsor. I just want to put out good information so that you all can get some good quality information, I guess. As far as these episodes go, we've had some excellent guests on, and I was looking back at some of these guests that we've had, and I don't know how they agreed to come on the show. You'll see later on in the season, I've already recorded several amazing episodes. We have some repeat guests, but we had people like the CMO of WebMD come on. We had the CEO of large healthcare companies come on. We had a huge kind of influencers within the health space come on. We've just had so many people come on that I don't know how they agreed to the show. And maybe it's because there's some sort of value to it, some sort of value to the message. But I'm incredibly grateful for all the episodes that we've had thus far and all the kind of message that we've spread so far about prevention. So, I encourage you, if you have not already, there are 70 great episodes out there. Go listen to them. You will hear myself back as a medical student try to ask some interesting questions. I think I've gotten a lot better since we first started actually podcasting, asking questions, making conversational. So if you're a new listener, then as you go back and listen, hopefully you can hear some of that progression. And if you are just returning, then I think there's some still great nuggets of information. If you've missed any of those, or if you just want to go re-listen, I could encourage you to go do so. That there's some good stuff back there. So looking forward, there's a lot going on. But first, let me introduce myself again. It's been a while. You might have forgotten who I am. My name is Ragav. I am a physician. So when I first started this, like I said, I started off in medical school. I completed my residency in physical medicine rehabilitation last year, and I'm now a fellow physician. And that means I have one more year of training left, and I'm doing a fellowship in spine and sports medicine. So I'm doing pretty much anything related to the musculoskeletal system and being able to put a needle anywhere to cure pain, help people get back moving is kind of my practice philosophy. When I see patients, I want to be able to help them diagnose their pain from where things are coming from, put together a treatment plan, help them get back to what it is they want to be doing. So whether it's golfing, playing recreational soccer, or taking care of their kids, whatever it may be, or going on a trip to Europe on a cruise or enjoying that cruise, whatever it may be, I want to be able to provide treatments and whatever I can to help them get back to whatever it is. So I chose my training route based on that kind of ideology and that vision. And so far, I am thoroughly enjoying it. I'm realizing this is probably what I was put on this earth to do and made to do because I feel energized by the work that I do. So that's a little bit about me as far as medicine, my journey in medicine, practice, all of those things kind of go. A little bit more about me as far as some of the other things throughout medicine. And one of the reasons that I got into this field of physical medicine rehabilitation is kind of a little bit of background in musculoskeletal sports to some extent, powerlifting. So I really started off as a obese kid. I had a pretty high risk of obesity, a pretty high risk of diabetes, heart disease, and all that kind of stuff, even in my teens due to just being obese. At some point, I think I was like 5'5" and over like 240 to it, like somewhere around that as far as weight goes. So definitely wasn't very healthy. I turned my life around after the wise words of my endocrinologist. And I started lifting and eventually got into powerlifting. So I was lucky and fortunate enough to be able to accomplish a couple of things in powerlifting as far as deadlifting over 700 pounds, squatting over 600 pounds. Unfortunately, my bench always sucked to only bench about 330 pounds, but nonetheless, I've been a lifter for quite some while and was able to establish a fair amount of muscle mass. At some point, I got bored and then I decided I was going to start running. So over the last, I think, like 4-ish years, I've primarily chosen running as my event. So despite competing in a number of powerlifting events now for the most recent kind of years, I've mostly done running events. So I've done marathons, half marathons, and even ultra marathons. So I'm actually, as you're listening to this, you might be, I'm not sure. I'm not sure exactly when you're going to be listening to this, but I'm running the Big Bear 100K Ultra Marathon on October 11th. So that will be my second ultra marathon. My first one was in October. So a couple of running things there that I have chosen to do, I guess. For some reason, I choose to do more extreme things. And I guess that's just a way of proving to myself that I can do difficult things. Along the entire way through lifting, through running, at some point I picked up coaching. People kind of came to me asking me about how I was doing certain things and whatnot. So I decided to start coaching. So I've had several clients along the years, even decided to pick up a certified strength and conditioning specialist certification from the National Strength and Conditioning Association, which is a relatively well-regarded certification. And it's the one that you need to have if you're training NCAA athletes. So definitely did some coaching along the way, had a couple of clients. Not really that big. It's never been my main kind of career, obviously, because medicine has always been there. But I just enjoyed coaching, help people reach their goals. So I've done that for a while. And then I guess media-wise or whatnot, I realized that like coaching, I should probably put something out there as far as things I've learned along my journey that people might find useful. So I started posting things on Instagram, eventually started this podcast, made YouTube videos, all those different kinds of things. So if you're interested in any of that, then all of my social media handles are essentially my name. So just look it up on Instagram, on YouTube, and you'll probably find something there. You can also find my website, which has links to all of that, which is www.ragavsharma.com. But regardless, we are listening to this podcast. So stay tuned for the end of the show to hear what I have in store because there's a lot of exciting stuff. But before we get there, let's talk about big topics in preventive medicine. What we are all here for is preventive medicine. Now, we can't get into the topic without talking about the huge elephant in the room, or the elephant that's kind of taking over the room and taking over our country, and that is politics and policy. There is so much going on that saddens me. It's very difficult to see a lot of these things that I'd worked so hard to become, and I haven't even necessarily started as a full-time attending physician yet. And it's seeming like whatever I'm looking at is the crumbling of modern medicine in front of my eyes before I've even started practicing independently. But there's a couple of main topics that I wanted to hit on here before I dive into a full-on kind of rant about where we're going. Number one was the rise of anti-science rhetoric, despite people saying, quote unquote, do your research. Um, and do your research has somehow become it's kind of ironic. It's become kind of the person who is anti-science. Because kind of the scientific method is a rigorous process whereby you have a hypothesis, you test that hypothesis, you figure out kind of what the results of the test were, and you accept or decline your hypothesis. And things build over time. It's not like you can just start with one piece of research and kind of use that as its end all be all. Research builds upon itself. So things that were done kind of centuries ago build on to kind of the basics of kind of what we can do today. And then the things that we did decades ago build on to what we can do tomorrow. And the things we're doing now can build on to what we're doing decades from now. So science is an iterative process. It's not a kind of one Google search or one passage or one kind of sentence. It takes a lot of nuance, it takes a lot of understanding, and it takes a lot of kind of understanding of kind of the background before you ask questions. Like with anything, you're only going to be able to get good answers to good questions if you know the context and the background for which those question is asked and for which the answer is given. So there's a lot of quote unquote people who say quote unquote do your research, and they do one Google search, find a line or two that kind of support what they're doing. And that ends up being cherry picking, despite what the overall body says, what the overall understanding of the scientific kind of literature and conclusions are. And that's kind of one of those things that unfortunately has been rising. And people who do not understand or who have a little bit lesser of an education in the scientific process and scientific methods kind of jump to that. And unfortunately, kind of as people are getting less and less as far as higher education goes, due to being priced out or a variety of other factors, they less and less understand what that process is and end up quote unquote doing their own research and coming to bad conclusions. So that's been difficult to see. It's a multifactorial problem. There's no real good way to address it. And despite how much, as clinicians or as science educators, we say, quote unquote, this is what the science actually says, this is how it works, it's difficult to communicate that kind of thing if the context and the background is not there. And it ends up becoming kind of talking to a brick wall because it's closed. There's no way for others to understand what that is. And it's becoming more and more so apparent. In the past, it wasn't a brick wall. For people who weren't as understanding or educated on certain topics, you could kind of reason with them. And now, unfortunately, that doesn't seem to be the case. So that's number one, as far as kind of general politics and policy goes, is kind of the rise of that anti-science rhetoric and kind of individualizing science, whereas it is in reality a huge collective of minds and information. Number two is the things that don't matter are being emphasized, and this is coming straight from the top and the people who are supposed to be in charge of our public health and healthcare in general. The United States has been the center of a lot of different industries and a lot of different things in recent times, and unfortunately now being the center of it, we might not have that title anymore because there's a lot of things going on. And there's a bunch of events you've probably all heard. You've probably all, if you're listening to this podcast, you've probably seen the news, seen posts on Reddit, seen whatever it is of just so much going on as far as the gutting of our institutions. So there's, for example, the panel of experts on vaccines within the CDC or in general within the Department of Health and Homeland Services, I think it is, being gutted and replaced by people who are not necessarily the most known to appreciate the scientific literature on vaccines. There's things like autism and Tylenol, which has recently gone up, despite no causal evidence kind of being there. There's just so much out there that has been pushed that doesn't matter as much and that is anti-scientific. And then kind of on top of that, there's things like seed oils. So celebrating small wins like taking oils out of fast food. And that's kind of missing the entire forest for random trees, where people think that seed oils like canola oil, soybean oil, and corn oil are at the heart of a lot of these chronic disease epidemics, and just taking them out of quote unquote fast food is going to help us. Problem is, people are still eating a lot of fast food, so it's not really going to help us that much. So there's things like that. There's also things like food dyes and celebrating getting red 40 out of things, or yellow 5, whatever the food dyes are, despite those having no real link to any sort of health outcome, and that being celebrated as returning to natural foods versus having artificial foods that are poisoning our kind of children and our food supply. So there's just a bunch of stuff that's coming from the top that's focusing on what doesn't matter, getting rid of what really does matter, and kind of how I would see it as a house of cards, taking out the base and then adding random like things around the house to make it look better, despite the house actually crumbling from the bottom down. So there's that. And then on top of that, going onwards, there's a bunch of other changes. I actually looked up what has actually happened thus far versus what's proposed. And luckily, not that much has actually happened yet. There's a lot proposed that I hope does not happen, but let me take you through a little bit of that. So there's a bunch of cuts that are proposed to the CDC, NIH, and a whole bunch of other organizations within kind of our health and homeland services. Some of those are a $18 billion cut for the year of 2026 to the NIH, which is a 40% drop. It gets rid of a whole host of institutions under the NIH and restructures it. And there's a proposed cut of 3.6 billion to the CDC, which is about a 50% drop from previous. And a lot of that is kind of getting rid of things on DEI programs and focusing back on the core mission of infectious diseases, despite that maybe not so much being the case for why those cuts are happening. There is a restructuring of the health and human services from 28 to 15 divisions, and then cutting off a bunch of different people and cutting 20,000 jobs from what it sounds like. And then in general, just cutting out a lot of other programs like things like global outreach, global vaccine programs, global health research, and just in general, a lot of stuff that has made America or the United States the center of global health. Being able to provide so much for other communities and for the world in general, and we're becoming increasingly isolationist as far as that goes. So there's cuts to that. Most of this, fortunately, is kind of projected budget cuts, so it's not yet happened. There's a lot of stuff that's been tied up in courts as being unconstitutional, illegal, all those different kinds of things, but we'll see kind of what happens with this. Despite all of these so-called cuts that have been happening, there have been some that have been announced, but immediately those kind of get canceled, so we don't really know what's going on. All we can kind of think about is if they're all proposed, then the idea is to cut all those back, cut back spending on a lot of the healthcare of things that actually make America healthy again, and push for things that don't really move the needle that much. There's also things like blaming of the healthcare system on kind of the current healthcare epidemics as far as chronic disease goes. And now, let me go on a little mini rant here. So I wrote a blog piece on this. You can go read it on my website. But essentially, my blog piece says, and I think that MAHA has co-opted what physicians should have been doing this entire time. So as physicians, we are here for preventive medicine. We are not here to just push pills, do all these different things for our patients. I don't know really any physicians, myself personally, who push pills just like that, because that's not how we make money. We make money from seeing patients and from being reimbursed appropriately for the time that we take and for the expertise that we have with patients. When I write a prescription, I don't make any money from that. Who makes money is the pharmaceutical industry from selling that drug. And there's a whole list, there's a whole kind of pathway of how money gets made in that, but I can promise you none of that comes back to me. I write prescriptions on a daily basis, and if I was getting some sort of kickback from it, then I would probably be a lot wealthier and have a little bit of a a background and all that kind of stuff, but we don't make medicine. We don't make money from prescribing medicines. We make money from helping people with our expertise. So this has been co-opted, and kind of the blame for all of these chronic diseases and for just quote unquote the pharmaceutical industry being so large has gone to physicians. And what we have done is nothing. We've just kind of sat there and taken it because we're so busy doing the good work that we do of taking care of patients that we haven't had time to kind of sit down and be like, hey, what's going on here? We're actually here for patients. I don't know what you're saying. We're the ones who are kind of doing the work on a day-to-day basis, and we're also taking the blame. So MAHA has kind of co-opted messaging that physicians should have had for a long time about preventive medicine. And really what we should be doing as physicians is educating our patients on what actually will make them healthy again, which is focusing on things like preventive medicine, which we've talked about so many times on this podcast, about the different pillars of preventive medicine, things like food, things like sleep, exercise, having some sort of stress relieving activity, behavior, whatever it may be, and having a sense of community. Those are the 5 big things, the 5 pillars of preventive medicine that we talk about. And I try to talk about those on a daily basis with my patients. Time permitting, obviously. If there's a lot going on medically, then I focus on the medicine, because my patients aren't here for me to talk about their support system. They're here for me to diagnose what's going on and for me to fix it. So we do as much of that as we can, and I think as physicians we should have much better messaging as far as that goes. But that's my rant. I can talk a lot about that, but my blog summarizes it much better. So go read that if you're interested. And the next thing is kind of the, as far as health policy goes, is doctors being required to quote unquote learn nutrition. This has been a hot topic. This has been a hot kind of suggestion that physicians don't treat patients with nutrition and with appropriate food. We just push pills. Once again, not the case. All of us physicians do learn some level of nutrition in medical school. And in my opinion, we should not be the ones that are teaching our patients about diet. We have so much expertise about so much other stuff that we can rely on our allied health professionals like dietitians and whoever else it may be that's helping patients with nutrition. There's so much going on in medicine that we can focus on, that a patient coming to us and us talking about, hey, you should eat more vegetables. Hey, you should eat more protein. Hey, you probably shouldn't go to McDonald's. Sounds condescending and honestly very paternalistic to patients. And this is not what they're paying us money for. They're coming to us to diagnose an issue, to talk about what we can do to manage their symptoms and how they can get back to what they want to be doing, not to talk about eating more broccoli. So that's a whole other thing. I'll probably write another blog piece on that, about why I don't think physicians should be talking that in depth about nutrition with our patients. But that's been another topic as far as like politics and policy goes and all those kinds of things. So we're gonna take a little break here because my mouth is getting dry, but we'll be back in just a second talking about some other hot topics in preventive medicine. All right, so that's a little bit of a Debbie Downer beginning to the podcast, where we're talking about a lot of the kind of things that have been going on in the public space regarding preventive medicine. However, there's been a lot of amazing stuff also happening in the last several years since I've kind of been talking about it. And one of the biggest things there is GLP-1s. This has been a bright spot in medicine, and it has been absolutely a game changer for those suffering with being overweight or being obese and just having, in general, excess body mass. There are a variety of drugs out there, and I'm just going to refer to generic names here. But 2 have stood out, and that's semaglutide and tirzepatide. Those have been effective for weight reduction, and what research shows to be around 15 to 18% of body weight at 68 to 72 weeks. And that is magnanimous. That is huge. There's pretty much been no other drug that gets close to it. I think usually people have lost maybe at like 5 to 10% of their body weight, but unfortunately regained it back. And this has been a drug where as long as you maintain it, you keep that weight loss, which has been amazing. And there's been a huge uptake in this drug since it came out. And as of my most current research, and what I found is that 6% of all U.S. adults are either on it or have used it at some point. And this is up to 22% in the population of those who are obese or overweight. So huge rates of people using it. I think this is honestly a quote unquote wonder drug. And this is one that should not be as stigmatized. I think the stigma is actually starting to come down to some extent because people are starting to microdose these these things, and the biohacker community is taking up to it. But there's a whole bunch of stuff out there. I think these are absolutely wonder drugs, and has been a huge plus for the world of preventive medicine, because we can bring down rates of obesity and prevent so many different things that come with weight-related kind of morbidity and mortality. Unfortunately, there's still a lot of work to be done with this, and a lot of that comes to the public space and paying for these drugs because they are incredibly expensive. A lot of insurance don't want to pay for it, and it pushes the burden onto kind of other payers. It's a mess as far as that goes, but the people who can pay for it, the ones who are a little bit more wealthy, have been using it. And unfortunately, there ends up being a little bit of a dichotomy there as well, where those who have the resources are able to use it and once again expand their lifespans and reduce morbidity and mortality. And the ones who are less well equipped as far as resources go are not able to use it. And this kind of adds to the health disparity that we have unfortunately been seeing kind of in modern times. So, that's something that is there to look forward to hopefully get these drugs cheaper and make them a little bit more available as far as that goes, to help the general populace out. There's a couple more things going on in preventive medicine. These are kind of just like controversial-ish, like just little things that I've noticed that have been a huge uptake in the last year to 2 years. The first one of that is everyone talking about being on TRT as a little supplement and quote unquote optimizing hormones. I'll probably have an episode on this at some point, just directly diving into this. But essentially, it's for dudes, it's become kind of a panacea just to be like, hey, I need to optimize my hormones. I'm feeling a little fatigue. I'm feeling blank. Let me hop on TRT and kind of optimize my levels. And there's been this trend, and this trend has been increasing due to direct-to-consumer home testing for things. So a company will advertise, hey, get your testosterone levels checked. A lot of people are actually pretty low. And then they get it checked, and fair and enough, it could be low on the test. And then all of a sudden they're like, oh, there's an indication. Let me get on TRT and fix that. There's a whole bunch of stuff. I'll dive into that in a dedicated episode, so make sure to keep an eye out for that. But the research has shown thus far that for those who do not have hypogonadism, or in other words, those who have normal levels of testosterone, there has been absolutely no benefit compared to placebo in randomized controlled trials. So essentially compared to nothing, like sham, like water, it has done nothing for sexual function, mood, quality of life, energy, all of those kinds of things. And thus the American College of Physicians and the Endocrine Society has advised against the use of it. And there are risks to things like this, and that can be things like increasing erythrocyte count, which is your red blood cell count, which can lead to things like clots, cardiovascular events, and whatnot. Although that hasn't been as seen in the literature, there's still harms to these things, but that has been a trend in preventive medicine. And then another one, kind of in line with the direct-to-consumer testing, has been holistic diagnostics, whole body MRIs, and this whole world that kind of biohackers and longevity medicine has launched, which is becoming more available. And that's kind of just, hey, test your levels for this. If it's low, we can supplement it. And there's not necessarily anything wrong to it as far as like financial harm goes, but there can be a whole lot more that goes on when you start over treating people, over medicalizing, and then also causing some sort of psychological injury at times too. So if we're getting whole body MRIs, you're bound to find something. And at that point, if you start focusing in on it, you might end up undergoing some sort of treatment, some sort of surgery, and then all those things do have harm. So there's a rise in all of these direct-to-consumer products as far as home health testing, for blood work, for just like samples, for imaging, whole host of things. It's been a trend in preventive medicine. I think it could be useful at some point. I think it reduces a lot of burden of having to go in and physically accessing physicians and expertise. But unfortunately, right now, these things seem to be not really backed by any sort of expertise, just broadly available. And it's people just kind of having fun with it to some extent and potentially causing themselves harm. I think there is benefit to it at some point, but I don't think right now it's been being used that effectively. Maybe at a corporate level for like corporate programs where they have like a whole company having these things available with a physician at that company also helping to be able to do this. But as a general use, could be much more useful than it is right now. And the last thing, as far as preventive medicine goes, is the rise of AI. And this is a topic I'm not that much of an expert on. I've been reading as much as I can about AI, utilizing a variety of AI tools within my workflow as a physician, as well as just reading about different things and the uses of AI in medicine. And there's two kind of big questions. And number one is, will AI replace doctors? Maybe. Who knows? We'll see what happens. There's certainly utilization for AI in medicine. Will it replace us? Probably not in the near future, especially where patients like bedside manner. They like actually talking to a human, but we'll see how that goes. And then the other question is, what are people's thoughts of physicians using AI? So why did I go to medical school when I can just type a search on ChatGPT on Open Evidence and kind of answer something? And a lot of that comes back down to what I said at the beginning of this episode, which is context matters, of having information, knowing which questions to ask. So I think in that way, for well-trained physicians who are able to utilize AI, I think it's going to make our workflows much better. It's going to make us much more efficient. It's going to make us much more thorough and make sure we don't make these little small mistakes from time to time that we do because we're all human. I think it's good for medicine overall. I think we just need to be able to use it to harness it a little bit better overall at a physician level. So that's kind of some topics in preventive medicine that I think have been pretty interesting over the last couple of years. If there's something you have found interesting, then please find us on Instagram at PreventPod. Comment down below comments of what you think has been an interesting trend in medicine as far as preventive medicine goes, and we'll talk about some of those in future episodes. And now, the part you've all been waiting for is what to look forward to. So, if you've been a long-time listener to this podcast, you know that I essentially don't think of myself as an expert in any one thing, and I want to get true expertise on the show. And that comes in the form of having other guests on who are actually experts in what they do and kind of asking them questions about that expertise and how that translates to real life. My biggest mission on this podcast is not just to have an academic discussion about things, about, oh, what is the expert opinion on this, but actually how that expert opinion translates to living better lives. Because at the end of the day, preventive medicine is about actually practicing preventive medicine and reducing the risk for a bunch of things. You don't do that in theory, you have to do that in real life. So in every episode that I have an expert on, I try to get practical tips for what we can do to reduce our risk for a variety of things. Or if it's a larger kind of public policy, that kind of thing, then what an organization is doing, what we can do to get involved in the organization, and all those different kinds of questions. So continue to look forward to having some top tier experts in what they do on this podcast. I already have a couple of episodes recorded, like I was saying, with some true experts on there. So look forward to that. If you have anything that you want me to discuss or you think is interesting preventive medicine, or you are an expert in something, please drop me a line, drop me a comment, just let me know, and I'd be happy to have you on the podcast or talk about that topic on the podcast as well. As far as the episodes I already have recorded, so I have one recorded on regenerative medicine, and this kind of goes within that kind of preventive medicine route as far as somewhat biohacking, but not really. There is true utility to regenerative medicine out there, and I think it could be pretty promising for preventive medicine. So I have an episode recorded on that with a true expert. I have the CEO of the AMA on the podcast. That's actually huge. The American Medical Association is the largest association of physicians that represent us and actually lobby on behalf of not only physicians, but our patients to the government as far as impacting policy, all of those kinds of things. So I have the CEO of that on the show. So make sure you don't miss that episode. Make sure you subscribe, all those kind of stuff to make sure you don't miss it. And then I also have a dean of a medical school in Oklahoma on the podcast who has been doing some great, really cool stuff as far as medical education goes to create a better group of leaders for the future as far as promoting preventive medicine, promoting better health in our communities. I also have an episode recorded on spinal cord medicine. This is a little bit more of a niche topic, but it's one that is pretty important to learn about because a lot of us don't think about what a spinal cord injury is. Just kind of understanding a little bit about the life that others have and some injuries that others have just adds a level of kind of knowledge and empathy that we might otherwise not. And it gives us a way to think about it and just generally, I think is really interesting. So I think you should listen to that when that comes out as well. Episodes I want to record, and this is like I mentioned already previously, I really want to have another episode on GLP-1s and longevity medicine. I think since the last time I talked to an expert on this topic, so much has changed. So getting an update on the topic is definitely warranted. I want to talk a lot about TRT because, like I said, that's been some sort of panacea that men have been jumping to, and I really want to dive into that and talk about why that is and practical advice for people who are thinking about TRT. I want to do an episode, and this might be controversial, on gun violence because the leading cause of death for children in this country, gun violence and trauma all those different kinds of things. So there's so much when there comes to preventive medicine of just reducing the amount of gun violence and gun deaths there are. It's kind of obvious. I don't understand how it's become political or controversial, but I definitely want to record an episode on that. I also want to do an episode on running medicine slash ultra marathons, because that's something that I've gotten into recently. And I think that a lot of people out there are runners. There's been a huge trend of kind of everyone also starting to run and just getting into quote unquote zone two training for cardiovascular or aerobic health. So I want to do an update on kind of running and running medicine in general. I think that'd be really cool. There's a whole host of other ideas that I have in my head, but once again, this is a show for you, for my listeners out here, and for things that we think are important in preventive medicine. This is supposed to be a community. This is not just me up here on a soapbox talking about these things. I'm here to bring actual change in this world regarding preventive medicine, and I want to push the needle, and I want to push these things forward so that we can all live better lives. So if there's anything you have suggestion-wise for an episode, for something you want to see, whatever it is, let me know. You know how to get in touch with me, either through the website for this podcast, through me on Instagram, through the podcast Instagram. There's a bunch of different channels. Get in touch with me. Make sure you're following it all. It'll all be in the show notes. And lastly, like I said, if you've enjoyed the show, if you like the mission, if you want to support the mission, make sure you are following the show. Make sure you are rating and reviewing the episodes as they come out. Make sure you're rating and reviewing the show. It's on Spotify, Apple Podcasts, all those different places. Help support, help grow the mission, help others live better lives. Like I said, this isn't me on a soapbox. This is the collective of truly trying to, in the words of some people, make America healthy again. I want to get us better. I want to make everyone live better lives. So I think that's it. I think that's enough of a ramble. If you've got to the end of this podcast, thank you so much for listening. There's a lot to look forward to this season. So we'll see you there.